Coming to the radiological examination, these two radiographs are commonly used for the assessment or in the case of the maxillary Midline Diastema. One is the periapical radiograph, and as I said in the start, the periapical radiograph has to be very standardized. For example, the source or the angulation of the tube and the film has to be exactly at the right angle, and you must use the holder while taking the periapical radiograph if you are assessing a case of the diastema, because the U-shape or V-shaped notch can be missed by if you are not having the proper angulation of the radiation. That's very important for the diagnosis of the U-shaped knot that is developed with the thick fibrous tissue of the maxillary frenum. Moving on, for example, at the age of 8-9 years, if the gap is more than 3 millimeter and you want to investigate what exactly is the ecological factor for this increased gap between central incisors, then I believe the periapical X-ray is exactly not the best radiograph for the assessment of the increased gap between the central incisor that is more than 3 millimeter. It's more advisable and it develops more sense to take the panoramic radiograph OPG for the diagnosis of hypodontia. For example, if the lateral incisor is missing, that is missing up to 2% of the population, there are very fairly high chances that your lower 5 that is missing up to 3% of the population. You want to check the presence or absence of the lower 5 as well if you suspect the hypodontia of the upper left incisor. For example, if you suspect the hypodontia of the upper left incisor at the age of 8-9 years, for example, at upper left incisor at the age of 8 years, but at 9 years if you don't find it, then you should take the panoramic radiograph, so you can be very fairly sure about it that where exactly is my left incisor, if there is possibility that is missed in the zone of the radiology. So it's more preferable to take the panoramic. Secondly, in case of pathology, if there's a Mesiodens, then Mesiodens can be fairly up and in between the roots of the central incisor, or even above the roots of the central incisors. So if you're taking periapical radiograph, then there are chances that you may miss the Mesiodens. Sometime I remember a few cases that the Mesiodens was found fairly high in the palate, and it was near the anterior nasal spine. I remember a case, so it's more sense to take the panoramic if you suspect hypodontia or if you rule out Mesiodens or any other pathology. So if you suspect something alarming, then you definitely can proceed for the CBCT radiograph as well. Thank you.